I think we're in an interesting time in value-based care and oncology. I think there's more and more momentum picking up in this field. It's a very complicated endeavor to get right. And I think a major point here is on the payment side, we're starting to move away from fee-for-service. We might not know what that end state looks like, but I think we do know we're not going to go back to standard fee-for-service. And at the same time, what's happening on the payment piece of things is that we're often aggregating care together into more and more discrete structures that form around things like bundles. So we're aggregating care together to pay for it, to move away from the incentive structure fee-for-service. Now, I think clinically at the same time, we're almost moving the opposite direction, where care is becoming more and more personalized, and in turn, it's becoming more and more specific and individualized. So I think there's a tension between what's happening in terms of innovation clinically and innovation and change on the payment side. I think what's really critical is to build better analytic and quantitative models in oncology that integrate together dimensions of what's financial and what's clinical. Ultimately, what we're trying to do is provide care for patients that's clinically appropriate and evidence-based. And those dimensions of clinical care need to be translated into what we're doing in terms of the financial models. And in many ways, standard of care and what's clinical in oncology really should be the starting point for how we think about financing the system. This requires putting sides together in healthcare, which often don't, which is the clinical and the financial. But I think that's really fundamental importance in terms of creating improvements and change in oncology.